A 55-year-old man presents to his physician because of easy bruising, splenomegaly, and fatigue. Results of the peripheral blood smear are shown in this image. Rapid treatment of this patient's condition could lead to release of contents of the pictured cells and the development of the serious hematological complication. If this complication were to develop, which of the following would most likely be seen on the peripheral blood smear? Acanthocytes, Burr cell, helmet cells, target cells, teardrop cells. So I have taken this image from USMLE and it is a very high yield question. That's why I thought to discuss with you. Here they're not asking that what is the condition depicted here, what type of cell we can see here, what type of inclusions we can see in this cell. They're not asking what is the disease. They're not asking what complication can see as a result of this disease. Complications are already there. Easy bruising, splenomegaly, fatigability. These are all most likely the sign of some sort of blood cancer. So they're asking that we need to find that what type of inclusions are these, number first. Number second, if these inclusions are seen, so what type of hematological disorder where we can find such inclusions? Number second. Number third, if we treat this condition, if we want to give chemotherapy or vitamin supplementations to this patient, if we treat this, then as a result of the treatment there is a release of these inclusions and there is a complication we can find as a result of the release of these inclusions. So number third, we need to find what sort of complication we can see, and number fourth one, that what type of cell can see in this complication which is as a result of the release of these inclusions. So we need to find four things in order to answer the question. So I will tell you one by one, and I will try to make your concept clear as far as this question is concerned. Okay, number first, these inclusions we can see they're called as Auer rods, and the cell we can see here, they are the blast cells, and these blast cells we can see in case of acute myeloid leukemias, or we can say acute leukemias. So the Auer cells or rods, these are the inclusions they can find in the blast cells in case of acute myeloid leukemia, and these are the sign of the acute myeloid leukemia: hepatosplenomegaly, easy bruising because of the thrombocytopenia, fatigability because of the anemia, easy infections because of the immature WBCs. The Auer rods are large crystalline cytoplasmic inclusion bodies, sometimes observed in myeloid blast cells during acute myeloid leukemia. So we can see these Auer cells in case of AML, acute myeloid leukemia. We can also find in acute promyelocytic leukemia and high-grade myelodysplastic syndrome and myeloproliferative disorders, but it is more specific for AML. So okay, now if we want to treat this condition, the blast cells, they are destroyed by chemotherapy. Once they are destroyed, these Auer rods start to release into the circulation. Now these Auer rods start to damage small microvasculatures. The blood vessels, they start to damage, the endothelial, they start to damage by these Auer rods. So extensive damage to multiple areas in the small blood vessels. So small injuries, because of that, what happened, we can see aggregation of platelets and the formation of microthrombi. So in a large, or we can say in many small vessels, there is injury because of Auer rods, and start to form platelet aggregation and thrombus. So in multiple areas, multiple thrombi are start to form. Because of that, the platelet count start to further reduce. The bleeding time increases, and we can see multiple hemorrhagic areas or multiple hemorrhages. So what is the condition called where we can find microthrombi in multiple in majority of the microvasculature, and with that we can find hemorrhages. So that condition is what we call as disseminated intravascular coagulopathy or coagulation. In DIC we can find multiple thrombi in small microvasculatures. Okay, so up till now we understand that it is a condition called AML, and the cytoplasmic inclusions, they are Auer rods. Once the blast cells start to destroy or damage by chemotherapy, these Auer inclusions start to release into the circulation, and they start damage to the microvasculature, and multiple thrombi are formed into the small vessels. That leads to thrombocytopenia and bleeding. Okay, now the RBCs, they are also present into the circulation. They try to squeeze over the thrombi, okay, like this, in these directions. So if I want to make a big diagram, this is the thrombi and these are the RBCs. So now the RBC, previously it was going normally like this. There was no obstruction. Now there is the obstruction, the fixed obstruction. The RBC now try to squeeze with this small area. Once it try to squeeze and try to pass with this area, the RBCs start to damage because of the mechanical obstruction. So there is a mechanical damage of the RBCs, and once the RBCs are mechanically damaged, it seems like this, maybe like this. So these cells, these RBCs, because of destruction mechanically by the thrombi, once they try to squeeze through the narrowed pathway, so these cells what we call as helmet cells or schistocytes. Now further, if you want to make your concept clear, I'll show you and I will give you a complete explanation. Okay, now in this image we can see that this patient has symptoms, physical findings, and the peripheral blood smear suggestive of acute myelogenous leukemia. In this image, the classical Auer rods, the cytoplasmic inclusion can see. The Auer rods are fused lysosomal granules. A sudden release of the Auer rods may cause acute disseminated intravascular coagulation and fatal hemorrhages. DIC is a disorder in which activation of coagulation cascade leads to the development of microthrombi and consumption of platelets, fibrin, and coagulation factors. Because the coagulation factors, platelets, and the fibrin, they are all the component of the thrombi, and these all components that are required for the formation of the thrombi. So once more thrombi will start to form, more platelet accumulation, more platelet consumption, more consumption of the fibrin, more consumption or utilization of the coagulation factors. So all these start to reduce in the circulation. So lay finding in DIC including increase the PT, prothrombin time increases. PTT also increases as a result, because these PT and PTT increases because of a decrease in the clotting factors in the blood, because they are already using. An elevated fibrin split product and thrombocytopenia because there is a lot of consumption of the platelets, and fibrin split because when you have stated that there is a formation of thrombi, and as well as there is a resorption, or we can say destruction of the thrombi, they occur simultaneously. So in DIC the formation is more, but it doesn't mean that they are not destroying. So the plasminogen and the plasmin, they are keep trying to destroy or convert the insoluble fibrin to soluble. So because of that, there is a fibrin spill products we can see as a result of destruction of the thrombi. A peripheral smear blood of a patient with DIC reveals helmet-shaped RBCs because of the mechanical destruction. And schistocytes. The schistocytes and the helmet cells are irregularly shaped or fragmented RBCs from forms that are generated when the RBC attempt to squeeze through the fibrin meshwork associated with a small thrombi. So here we can see these are the broken or fragmented RBCs, and these are what? The helmet cells. Thank you.